MD. This is regarding to give you an insight about MD Family Medicine selection exam, which is very, very competitive exam, and it's very popular among the postgraduate trainees as well. So not the postgraduate trainees, the medical the doctors in Sri Lanka, they are the really interesting because we can tell you that for sure from the number that you are going to sit for the selection exam. Coming to provide you little bit detail and to how to overcome these challenges to get into the training program is the main thing that I was thinking to give you on. And to be honest, this will be conducted with the Family Medicine Forum, which we are engaging in the postgraduate training in the family medicine as well as the MRCGP international exams, where a lot of doctors have enthusiasm to achieve the career goals, even to migrate to the other countries as well. So I'm Dr. Malkanthi Galhena, consultant family physician and the postgraduate trainer, as well as the examiner in the PGI in Colombo. And Dr. Jane is senior registrar, acting consultant in family medicine, working in the University of Moratuwa after completion of his training. So he's one of the iconic person that achieved the success through this very, very competitive exam that he faced, and he achieved to the goal of getting MD, the board certified MD qualification. So that's what I know you also having. So to achieve your dream, we too thought that we are the eligible people to talk you because having the experience of lot of challenges that you all are facing in order to achieve this goal. So thank you so much for joining, and I need to go ahead little bit according to in order to give you the competency to the roadmap for you to go to achieve this competency. So can you then move to the next slide, Jane? So, you give me I will, right, okay. This is what we are going to cover today. So why the family medicine, better to select as a career, and as well as the selection exam components and the training by Family Medicine Forum that we are specifically provide. So you to achieve this goal with the focused relevancy to get the preparation and the specialist recognition after the getting through the selection exam, you are in the pathway to get the specialist recognition, and the challenging and solutions are the main thing that we are going to talk. And we are going to talk about little bit about MRCGP, fasttrack.com, the platform which provide you very much novelty experience for you all to go through on your own learning by going to all the components of your exam to practice yourself more than even after the group discussions to clarify the things. We have the online platform ready, prepared by especially me and with the assistance of Dr. Shane as well. There it will provide you OSCE guide and written OSCE guide, MCQs and the SBS, which are being focused for the very much important topics that are highlighting at the PGM family medicine exams. So these are the things that I'm going to cover. So can you go to the next one? So as a career, right, it's worth choosing. Why I'm telling you, it's, the first contact care. That's the front line of healthcare. You are going to become eligible as a specialist in the first contact care, that is called primary care, where all, the levels are coming behind that. So because you have to have your competency to treat the patients who comes as all members of the family, irrespective of the age and sex and irrespective of diseases, which you are being empowered after this training with the correct knowledge in order to provide the treatment with confidence. So that is the main important thing. You are the one going to decide to whom that patient, they're going to hand over at the specialist pathway, any other specialist, or the patient that you can treat and follow up in a successful way. So that is very important. And so you are being recognized among the patients very well at a higher level. And the fast growing specialty in Sri Lanka, not only Sri Lanka, even the the grown up countries like Australia and in the UK and where the other countries like New Zealand, and as well as most of the countries are having very high, the demand for this specialty, because this is the ideally, even though in Sri Lanka it is called GP for the just passing out MBBS doctor, it is not that. There is a fully qualified, the medical professional who have been trained in the discipline of family medicine in order to achieve the competence for the treating of your all family members up to the red flag diseases and the selection of the red flag diseases as well to hand over correctly to the other specialists. So because of, and in Sri Lanka, that, the specialty has been recognized in 2010. And so, but still, the postgraduate training, all inclusive around 70s, there is a huge, the huge availability for you all to get through this exam and getting into this specialty where it is being recognized not only Sri Lanka, it's very well highly recognized for you all to go and the live with your families and all with very, the luxury life, because their salaries and all very high. So it is being recognized in other countries. The accepting the routine pathway to go for the GP system, they will give you the without supervision to train you there and provides very good salaries. So because of that, it's another important thing. You are coming to this stream. And in Sri Lanka, the lot of currently the base hospital and above hospitals all are having up to the National Hospital outpatient department is the primary care place where functioning without any specialist. There is now we are in, the being specialist family physicians in base hospital OPDs and district general, but the government is planning with some obstacles are there, but anyway, that can't be decided. It has to be, will be open to you all to go ahead with all the vacant places so far functioning without any supervision, whereas all other the departments like secondary care, tertiary care are functioning with supervision. So in Sri Lanka, there is a huge opportunity for you all to go ahead as the specialist in the even National Hospital OPD to give the correct guidance to the medical team. And not only that, it's, the diverse practice settings, like, the job opportunities, not thinking about other countries, it's really, really well open for you all. And in Sri Lanka also, Ministry of Health, all the hospitals, base hospital and above, the OPDs are, the most of the OPDs are vacant. Only the board certified consultants are 16 for the currently. So there is a very good avenue for you all to get that qualified and come. And you are being equally recognized as the other specialist in this country by a service minute. So you are having equal privileges like the salaries and the recognition, training and everything. So you can get the opportunities. So it's ample opportunities are there for you to maintain your status as a specialist among the other specialties. And the university department also, they are going to open new department of family medicine, because International Medical Federation is being recognized 6 disciplines clinically. One of that is family medicine. So others are medicine, pediatrics, gyn and obs, psychiatry, and other one, and plus our discipline. So because of that, it's not that you will not be de-recognized in any place, anywhere. And international mobility is the one that I talk to you, and even not only being the doctors, the practicing the specialist grade GPs in other countries, you will get a chance to go ahead with your ladder for the earning, the credibility by the participating for the world in the leading conferences, and the going ahead on the ladder to maintain your status. So that is the important thing that you have selected. So I'm very happy about you all. So it's really good to be with us. Right. Go to the next slide, Shane. Right. This is a specialist recognized, I told you, local and overseas. So you can go ahead next. No, just to tell you about the local recognition, as the board certified, the specialist, the family physician or board certified consultant in family medicine, right, which will be awarded by the PGIM after getting into this stream. And from this year onwards, they have increased the number to 20 for the annual recognition. That is the bottleneck that you are having. But the Specialist College of Specialist Family Physicians, the Sri Lanka College of Specialist Family Physicians, we are going to put a lot of pressure. A lot of pressure to, lot of pressure to the Ministry Health authorities to increase the amount that, even though the Director General Health Service in 2 years back also requested to get more, or even 25 from the selection examination, which has not been happened, but this time surely 20 is going to take it. But more than that, we are fighting continuously. So there is a chance for you to, but you have to get ready properly. And then the pathway for the fully regulated, and it's within the specialist recognition in this LMC, register as the qualified specialist in that. And as well as you can do your standard practice to provide primary care at your own GP level, or at the private hospitals, even to do the first contact care for selecting the patients and treating patients by your own, as well as you can the handover at the correct time for others. But the handover, according to the guidelines only, you have to do. It's very much the limited number of patients only we are going to hand over. It's not always the handing over the patient. That is your competency that PGIM is going to give you. And overseas recognition in such a case, post-MD training, include the mandatory 12 months, the training, overseas placement, and to get the genuine international exposure. There are no exams, but international exposure will be given to you, and you have to do the little bit, the active work with them. And we being the train in UK and as well as Australia are the main consultants that are working, right? And the preparation for the resources, that is, as the MRCGP fasttrack.com, that our website is being recognized throughout the countries, Australians and UAE, Bangladesh, India. Those are the countries that they are using our website. So because of that recognition is there for you all, more than the board certification, that Sri Lankan, the MD is being recognized very highly. And we want to tell you that is the evidence. That's why they are coming behind our training as well, because of the trustworthiness. And the pre-board certification assessment is there just for the viva and the oral presentation after your the overseas training will be going to give you the board certification. Next slide. So nothing to worry about that. Once you work hard and according to the instruction that sharing the examine experience and the training experience we are giving, so you may be able to, definitely you can get this training after getting through the selection exam. So these are the way pathway. This is a PG diploma in family medicine also there. But straight away you can come to the MD standalone course as well without getting the diploma. And the other thing is the MD training, the 1 to 3 years, right, in the local training, and the final MD exit exam, which is not the competitive as like the MD selections. Once we train them, most of the the candidates will get through almost all, even 100% success rate also there. So nothing to worry, but you have to worry getting into the stream and the post-MD training in the local plus overseas and then the board certification. The next. So regarding now only your important thing is coming up. We are focusing for these things, right? That is to give you a very good insight about the MCQ paper and the written OSCE paper. And the OSCE, the clinical consultation practices in front of the examiners. These are the 3 components that you have to. So for MCQ paper, there are 260 marks for 3 hours, right? The paper is going for 3 hours, 40 true-false questions and plus 20 single-based answer questions. So important thing in true-false answering is the tricky that you have to be very careful not to know that is the 1 minus 1 plus and the 0 unattended. That is how the correct mark, the 1 plus, the wrong mark, the minus 1. So which is going from your answer that you marked correctly as well. And the 0 in the sense that if you unattempted, right? So better to be 0 than going for the minus 1. So keep that in mind, understand what it is. And SBA, single-based answer, the plus 3 marks to each question, no negative marking. Here in the MCQ, true, false answer, the negative marking are not carried to the next, question. Only that is within that question, it will be ended, whatever you mark. But the marking in true, false is very, you have to be very tricky. But if you have the very good knowledge and you are confident about the answers and after reading the question very well, then you are there to get the plus mark. Otherwise, if you're not sure, so on the fence, so better not to mark it because your plus mark also will be going there within that question only. So because of that, leave that, the not sure question and go to the next question. That should be the trick that you have to practice. Thinking about the getting the marks by chance will not happen, right? So the hard-earned marks also will go down within the question. So better keep that in mind when you are going to, that is the main important thing that you have to master when you are getting the practice in MCQ paper. And SBA, it's the 3 marks for the each and no negative marking. So when you're going to do the SBA, the trick is you have to read the stem with, the underline, correct, the important wordings and the sentences. Because clinical scenarios also there, or sometimes the short stem also there. So such a case, and the final, the question, what is the most appropriate management or most appropriate investigation? Like that, they are highlighting something which should be the important thing that you have to mark the question accordingly, right? Otherwise, because question carries, the 2 answers where you can't select one from each other. That is the secret behind the SBA. Always you think either this or that is the correct. Only 2 out of other 3s you can close your eyes and mark it as the wrong. no need to mark. When you're going to select the correct marks, it's very difficult for you to select from the one other. There are two such answers are there. So in such a case, if you are the more sure, so you have to, but since no negatives, you can in the mark either other option as well, but you will not get marks for that question then. Shane, I can't see the screen.
Madam, there was a small error in the slide. I made a correction.
Good.
Yeah. Proceed. Yeah.
Okay. And coming to the written, that is all right, written paper in the sense written OSCE, right? That is what? In written OSCE, this is component has been changed because paper has mentioned in the written OSCE. I will show you how the written OSCE comes in your exam. Written OSCE in the sense always, written OSCE also they are looking for your clinical competency. Through the computer screen, your questions are coming. And when the questions are coming, it's a limited time. There are 4 questions, but each question has, the 3 or 4 components which carry marks separately. And regarding that question is coming under the stem of, the main question they gave. So, but the problem is, if you have not trained for that, you will not have the time. So that is the most important place that candidates are coming down from the competitive, the MD selection exam. So qualification is very difficult if you have not, the exposed to this for some time. So because of that, your brain must to train for that as well. They are according to the clinical scenarios. They will give you the investigation. They will give you the skin lesions. They will give you the reports, and sometimes they will give you the clinical scenario only, asking depending on anything, everything they are asking about the abnormalities of the reports that you say, but the mention, the possible diagnosis like that. There are particular secrets that when you are going to write the diagnosis, which is if you don't know those things, definitely you're going to fail because you are wasting your time writing unwanted things. So they are only the very much focused answers they need, but you have to practice that before and go to the exam where you can get the necessary marks in order to getting into the training stream. So we will show you 1 or 2 questions in our learning platform so that how to get ready for that, to give you an idea. But the main thing is the MCQ and the SBA paper where you have to get the qualification in order to sit for this written OSCE and 4 OSCE components where it's coming from mainly the medicine, surgery, pediatrics and the genomes. Right, but I know for sure the last time there was the cat bite for the selection exam, but it is coming as the first contact care in surgery. So that is how it is coming, even not in a larger scale one, but your knowledge regarding correct management is very much important. It should be evidence-based knowledge, not the knowledge that other doctors are practicing. And there is an art to write that, the answer in the way that you can manage your time. So please be mindful to get that training correctly. All right. So coming to the next slide.
Just hold it there, madam. Right.
Okay. I know how hard you are going to study for this exam because of the competitiveness and how much hopes that you are having to get into the stream. And we are very much ready to help you because through the experience that we are having in order to shape you to know the exactly aligned to the exam competencies. Otherwise, just in the going here and there, but reading the question books or participating for the so-called programs here and there will not give you an insight. but you have to get an idea those things are better, but you have to be focused because of the highly competitiveness of this selection exam is the main, the message that you have to get into. But it is not unlikely, right? It's interesting. And the thing is study. The group study is very crucial. It's very, very important for you all to cover the almost all the disciplines up to the red flag disease management you have to know. And only the red flag diseases you have to send. So because of your knowledge should be very much in the rational and the evidence base in order to provide very good, the safe patient care. So patient safety is the main thing that examiners are looking for. So if you just mention about, the wrong drug, the wrong antibiotic, or the antibiotic which is, which is a must, but its side effects are very much nasty. So in such a case, you have to come out and tell them, tell the patient, so this is the drug, name is that, the dose is this, the duration is this, but you must know about the side effect like this thing. For an example, in doxycycline, in taking long-term basis for the acne, in secondary or the tertiary stages, mild, the moderate to severe acne, then you have to tell that it will give you gastric, esophageal irritation, where esophagus will be damaged even. So tell the patient to get the tablet with, the erect position and a lot of water. It's very important like that. You have to, the examiners are looking for that as well. That is because of the patient safety. So coming to the OSCE, that is the consultation clinical practice, where the examiners are looking for you under the four skills, where how you are going to establish your doctor-patient relationship through the patient in order to get the patient information correctly by establishing the doctor-patient relationship. That is the consultation skills are the one that is you are getting marked through by practicing that. And the next thing is the data gathering or the history taking skills. Where examiners are looking for you identify the correct problem according to the symptoms and the signs, and the exclusion of the other possible differential diagnosis common and the common red flag 1 or 2 diseases as well. Not just for an example, the management of chronic sinusitis. It's the patient coming with chronic sinusitis, but you have to exclude underlying because it's a chronic headache. You have to think about the possible diagnosis differential like red flags as well, the brain tumors, and as well as, in case of maybe the cluster headache or, the maybe migraine headache. So you have to identify exactly what this is and manage it after exclusion. Right? So that is the important thing to manage chronic sinusitis. You have to think about other possibilities and exclude. That is the secret. So there are 4 live stations and 4 written OSCE, and the score should be the more than 50%, the aggregate from 3 components. Like out of 800 to 400 marks should be there according to the PGM prospectus. So we'll go into the next one. Yeah. So we have to focus your preparation. That is the very important, the talk that we are going to tell you, right? The first thing is, this is a clinical discipline I told you. So you must be, read about the knowledge to gain for the patient management. That is the safe patient management, the management in the sense, the identify the patient main complaint and what are the possible other diseases that the same way that main complaint comes, and as well as, the correct diagnosis confirmation by the end of the history taking, but not to confirm that, but to confirm with the clinical examination, looking for particular signs and exclude other possible diseases that you thought before, and then coming to the correct investigation and going for the pharmacological and the non-pharmacological management and the safety netting and the follow-up in a way to address according to the best evidence-based guidelines. So in Sri Lanka, the PGIM and the medical education will in the tally with, they will always go with the local guidelines. For some only we have, unfortunately, but mostly the NICE guidelines and, the American Association of, the particular colleges guideline as well. So you can follow it. So guidelines are another a very important thing. To the summaries of guideline you have to know, right? Because for an example, if you get a fever patient with sore throat, if you know the knowledge about the how to differentiate bacterial sore throat from the infectious mononucleosis, it's clinically more or like same, right? So you must have the knowledge about in history how to identify, and in the examination how to differentiate from each one the other, but it's difficult. But the going to the examination, if you find that the hepatosplenomegaly, particularly the splenomegaly, in case of the such a pharyngitis patient with the posterior lymph node enlargement, not the anterior lymph nodes, are the infectious mononucleosis clinical diagnosis, right? So that is your knowledge. So it can't be given by the other patients, so other people, right? But having discussion and having participation for the specifically focus the topics discussion case classes, right? So you can get this knowledge. So then you can apply it, and management, you have to be evidence-based to reassure the patient that it's the self-limiting and only the symptomatic treatment with hydration and avoid, you must tell the patient, if the patient is competitively participating for sports and all, to advise to avoid that because of the risk of splenic rupture. And just to confirm, it's the antibody levels for the infectious mononucleosis, but the specific antibody levels, but it is late to check that. But earlier we were checking with monospot, is it's a supportive diagnosis, which you can, more than that, the full blood count show you the lymphocytosis, relative lymphocytosis, and with the reactive lymphocytes are the one with that clinical the clinical the positive clinical findings, the information and the explanation. The examination will give you to come to the confirmation of your diagnosis. Then the supported, the evidence-based management you have to practice. No need to give antibiotic for such patients. If you give the antibiotics, examiner will mark you negative, although it shows like bacterial pharyngitis. That is your knowledge to identify who this patient is, either in IMN patient or the bacterial pharyngitis patient. And the difference between bacterial pharyngitis management, you must know. Those are the very common topics. Like you must know the common topics that the PGM is going to question about that. It is being within the examiners. We know they are the inspiration, right? Because some people are coming with very rare questions, but when we are going to select these questions, we tell that no, it's not common because we are in the core groups. Then we tell no, this is not a common question, common problem that we can see. So because of that, we have to take it out like that. But anyway, some examiners are arguing and putting one or two uncommon things, but mostly it is very friendly exam, so don't worry. But if you know the focus properly, like you have to go to the, for an example, you have to know come to the Kalubovila hospital. So you must know how to come the Kalubovila hospital from the Colombo if you're coming, right? You must come to the 120 road, and then there you have to come through the Sunandarama road and to the hospital. Or you can coming with the Gold road, then you can straight away on the Dehiwala Kohuwala road, that the Kalubovila hospital stand there. Like that, you must know how to achieve this success through the correct paths. That is the very important thing if you are really wanted to get through. All right. And the coming to the clinical family medicine, in the sense, common things are common. Always, the adult problems, and the pediatrics, surgical, gynecops, and psychiatry. Those are the things, and preventive medicine in the community medicine. Those are the things most commonly they are asking, but common things are common always, right? For in the women's health, for an example, in the young UTI, the lady comes with recurrent UTI, you must know that is because of the sexual, the relationship, the frequently that is getting after marriage. Or if the elderly lady coming with, the recurrent UTI, so you have to think about it should be the bladder cancer to exclude, or any malignancy is possible. So, or the bladder, the that is called detrusor muscles instability with postmenopausal bleeding with poor hygienic practice can get, the infection. The patient is not washing the back passage properly. So, but these are the common things that they are asking, because common things are common. So, UTIs in any age group is being questioned, right? And the chest pain in any age group is being questioned, because different, the adults I'm talking about, in chest pain in adults. The thing could be possibility. You must know the differential diagnosis and how to know the differentiate each the one from the other one, right? Red flag one from the non-red flag one. So that is your knowledge. So, and the chest pain definitely, and symptom wise you have to get ready to discuss the question. Even back pain in young is different. Back pain in elderly is different. And the limping in the small children is another common thing that they are going to ask the question. And the infantile colics are the common things. You must know the knowledge. Like that, there are particular pet topics for this exam, right? So because of that, you have to focus on about that pet topics discussion, and to the study on your own even for the topics. But the group study is very important, and the guided, the training from a particular another responsible, the trainer also very important. The coming to the second thing is the community and preventive medicine. That is, the regarding management of health risks in order to prevent them going into the diseases. That also very, very important thing. They are going to ask questions like, the NCD prevention. Like if you identify, you must identify the underlying possible risk factors like weight gain, and the familial, the risk factors, genes, and then other causes like for the poor dietary practices and lack of lifestyle, or sometimes the taking the long-term unwanted in the not prescribed drugs like prednisolone or NSAIDs. Like that, there are so many things that they will ask about prevention, and the cervical screening at any stage. So how to interpret that, and the NCD, what are the HbA1c levels, and if such a patient comes, how to manage, are you going to start the medication first or not, and what are the grades of high blood pressure, where high blood pressure need to be managed with, the pharmacotherapy or not, only the lifestyle. Those are the knowledge that they are going to question in NCDs. And coming to the cancer prevention, also very important. So those are the things, and even degenerative disease prevention like osteoarthritis prevention, and the degenerative neck disease prevention. So you have to, once you detect that such a risk of the patient, the overweight patient always climbing up and down in the staircase, and then you have to identify that risk and address the patient that minimize the weight in order to the giving the osteo in future. So those are the community and preventive medicine. The research and evidence-based medicine, it's very much little, right? But they might ask one or two questions regarding some, the statistics, right? So an evidence-based practice, in the sense, very common that I told you in management, that is being the focus, right? Not research is, the statistics are the one, but the research evidence-based management, according to the guideline, is very, very important, right? So you must know the guideline-based practice for this on a different, the diseases. Like for an example, in cellulitis patient, they're coming with cellulitis and the patient is having underlying diabetes, then you must know how to treat and what is the correct antibiotic and how many days to treat. So admit, in case of swelling redness for initial IV antibiotics and, the after the CRP is coming down, the patient should be discharged and the another rest of oral antibiotics, the has to be the go on for about 14 days cover to prevent osteomyelitis possible. Like that, there are some things that you must know in each and every the category, right? For an example, only I told you, and the communication and the professionalism also the very important. That is to establish your the doctor-patient relationship. I told you to the talk to the patient very well, right? And the calling by name, greeting the patient, looking at the patient, keeping very good eye contact, not to miss the questions that he is telling, the answers he is telling you, give the information. Sometimes otherwise you will repeatedly ask the similar questions, particularly in case of OSCE and all, the question, the examiner will mark you down and this will be also question at the MCQ as well. Practice management little bit, not much more. That is, the in administrative part is not that highlighted nowadays, but the exam technique and the time management is very crucial. I told you the techniques, read the question very well, underline the key, the sentences and identify what is the question regarding. Finally, then you have to go to the selection of the answers, true, false, and the SPAs and the time management. Time management is very crucial. It depends on you how much you are going to practice because brain needs continuous, the inputs with the timing and all, the correct the way. Otherwise, if you do here and there, you will not get the competency. It's same like the driving the car, which you don't have the competency. You are going to decide to get the learning for the driving car and get the license with the authorities, authorized people, and then you drive on yourself. So the final this thing in the exam, in the sense you have to drive on your own. So up to now you have to get the assistance from the relevant people and to the sharp your the skill. That's it. So going down. Right, common challenges during the preparation are the very, very important thing, right? So which are the things that you don't know mostly. So you're just going behind the people and get your time wasted, money wasted, but you're not being focused. For that, you have to be very much, think about, the how can I go with such, the to find out the reading materials and the practice based things and to finally the doing the get to know the art of this exam by going through the past papers and the recognized trainers and then go ahead to the final test. That is the same way as the to get the driving license, right? So if you go to the wrong if you not read the book, you will not get the knowledge about the road regulations and the rules. And but if you go to the wrong, the person that driving, if you select some friends to go, we'll see another friend to go and get the training with the learner. But if that learner is not dedicated to get the license, but because of the just you told he is coming, so he will not attend with you at the correct time for go to the training. There you are not get the moral support from having such a friend for you to go ahead through that. So you can discuss the common mistakes that you have done through the lessons and all. So it's it will be again the mistake that you do and the same way the exam. And then going to you have to select the correct the group to discuss and share your knowledge. Definitely, it's a must, right? Telling you very important part of your success to identify the correct, the colleagues to the share your knowledge and to have the discussions. Then coming to if you select the wrong, the learner, the authorized learner, but they are not giving correct time for you all to go just get on to them. So many people crowding so that earn money. And get them, giving a very much little time to the practice with them. So you will not take, you will be not, getting the competency for the given time to sit for go to your the trial. At that time, you don't have get the enough training because it's not focused as well. In a halfway only you have got that, so you are nowhere. So you are always out from the competition, right? It's from that trial you are out. Like that, you have to select the correct learner and as well as the correct trainer and the with examination and the exposure as well. Otherwise, whatever said and done, so no the insight about the examination, it's no point, right? Because it's an art. For a particular exam, there should be different arts. So you must know that art as well. So you have to select that as well. And you have enough time. So it's a high time. That is why I thought to give you this knowledge. And the other important thing is, so when to go to the exam? That is not the exam while getting this all the competencies, right? Reading materials and the practicing the correct scenarios with the examiners or the trainers, whoever. And finally, once you get the competency, you must the go to the exam day on particular day, the 1 hour early, before that time, and go and the ease your situational anxiety to the exam hall, being hang around in the place and then you just discuss something with your colleagues in order to get some more knowledge in that situation. But the situation you have to be the familiar. So going 1 hour before to the exam station and be ready with your everything, the documents and all before going to the exam. And the go early is another very crucial thing, right? So these are the things that I need to tell you. And I will show you when you are going to practice what are the common things that the common topics that you are going to get and how to practice it as well, right? Okay. So here the fierce competition is there, so you have to come out of 80 candidates to that 20. And the other thing is but if you do the studies with your colleagues genuinely, you will get that competency. Don't think that I should not share that with these people, but the group is group. You are common for the sharing that thing. So if you do the genuine job with interest, you will get selected. So don't think that no need to divulge the information to the others. That is not a learning opportunity then then the more you do the mistakes while doing discussions and attending to the classes. That is the most important, the thing, that reflective learning in order to correct your gaps. That's very, very crucial thing. The talk with the trainers, examiners, or your colleagues during that study time and identify your gaps and in order to correct that. That is called the world famous reflective learning, right? It is because before the exam, you have to make the mistakes and identify that and get that corrected. But in the exam, you should not do. But the people who are keep quiet will go and do such a mistakes at the exam. So sorry for them. So workload versus study time. You are working, I know, for sure. So you have to have the keeping other the work, like the family commitments and the sort of other work and evening practices and all. While doing, you have to balance. You have to have at your convenience the fixed time for you to study, for the group studies, for the learning under the trainers and examiners, and to practice on your own through the some study material. So it should be fixed from the beginning. Otherwise, you will be ended up nowhere. So that is you should not commit you should not neglect the other parts as well, but have to have your physical and the mental well-being. You have to balance that. So balancing according to the schedules are very important with the groups and with your training. Okay. And then studying in isolation also needed. I told you that it's very good, the learning platform forever that we have in Sri Lanka. It is not there. Such a study, the materials are being collected at the same place that with a great difficulty of my examine experience and as well as my MRCGP examine experience in 12 years. As this is the postgraduate, the MD examiner and DFM examiner, I collected those things that I prepared with the support of Dr. Shane and the team. And we have a very good learning platform for you all. That is, once you go into that learning platform through the website, we will charge a very nominal fee for you all. So, and from there are more than 2,000, the single base questions. With the, once you go to that, the clicking that the training to get to the exam, right, before you are going. Same way that it can get the training, you click your answer and then your correct answer will come with explanation. And the other thing is the MCQ. Also same true false questions. Also several lot of questions, because it's a common areas are being covered from that. Not just the blindly prepared ones. The very correctly selected according to my experience. It will be the way that you can find it out. And the other important thing is for your written OSCE, as well as how to practice for the written OSCE, just to get an idea, because only the very limited time once you get through from the MCQ paper, the only about less than 1 month, it's 3 weeks last time, I think. It's not enough really for you all to being prepared to face this competitive exam. So you have to have some idea before you are sitting for the MCQ paper as well. That's a good thing. So I will show you a little bit on that so that you can use it very well. And it's within the discipline, not regarding the past medicine and all that most of our people using for the secondary test, being prepared for the secondary care and tertiary care. It's only this platform is for your primary care needs, right? And the most common topics. And the other thing, you must know how that the video in the consultation is going on. It's the practical videos, 100 practical videos are there, the real case scenarios coming to the exams. So these are the very good the guideline and the nice guideline in the very good summarized form and the reader friendly way. Because whenever you want to go to the guideline, it's being very much the very the bad impression coming. You will feel hectic, not where to read and where to stop. So, but it has been the very well the organized in a way that go for the only the necessary information only. So that is another thing. And limited study resources are being covered by us by the Family Medicine Forum for you all. So, and the vast, the and the other thing is we are being going to the charge for you all, because you all are our country people, which the doctors I know don't have much money for that. We are going to give you the nominal fee for the MD selection exam as the very good resource. You will definitely tell me at the end of exam, it's grateful to me because of providing that. And the other thing is regarding coming to the Shane, can you go to
Yes,
the
madam.
previous slide?
Okay. Yeah.
There the unfamiliar exam techniques are being can be learned either from the expert examiner or from the learning platform would be helpful. And the syllabus, it's a very huge syllabus that you have to cover all the specialties to a certain the limit that is being that also it's very important for you all to know. That is from the prospectus, the guideline gives you that. So having that, you have to go for the studying, right? Everything provided in this platform as well, in case if you want only. And going to the next slide. It's a new experience. That's why I thought to sharing this about, the how to overcome these challenges, start early, plan structurally, the way that I told you for your reading and the learning process, right? Follow the prospectus-based study timetable from the day one, and the join for the guided training. That is, I have already told you that the structured program brings organized resources and the past papers too. And you have to select it carefully, not to go behind internal medicine, secondary and tertiary care, the learning materials. That is, please don't waste your time, because it will not be the assess in such a depth, because our discipline is different. We are the first contact care, but breadth of knowledge has to be there for all the diseases in all family members, up to the guideline management at primary care and when to hand over. That is the important thing. And study flexibility online, that is online learning, the FITS preparation you have to select to improve your clinical skills, right? And this is regarding because you are working, so you have to have your own time to go there, and online platforms will give you the real this thing. If you find another good platform, better go and study. But I know that we have prepared such a good platform for you all. But if you find some other platform, it's up to you to select it and go and do your study. And build the peer circle. I told you, you have to have a good friend circle where they are really genuinely interested to get through the exam. And then focus on high yield topics. That's what I told you. High yield topics in the sense the exam will be focused on those questions. Always it is there. You can't say no, right? Always it's the exam is coming with the high yield topics only. So you must know these things, and the learning platforms will provide that as well. And the practice time mock papers. The mock papers are very crucial. Each and every exam after the training that we have trained the two groups now. So accordingly, we have done the very successful, which closely aligned to the your MCQ paper. We have done the mock exams. So where they have given us the very good, the positive outcome. The last time our training, out of 17 candidate, 11 candidates are being ours. So we will publish the names and all because they are with us from the beginning according to the rules and regulations that I told for you all to, not to the rules and regulation to me, but for you to understand what is the perspective of this, the victory, right? So that is how, right? Okay, now you can the mock exam papers also, they are in our learning platform. 3 mock exams, right? In case if you want to try. The next. Right. Structured training by Family Medicine Forum is being given just to the recap that what we are doing. In case if you are interested only, otherwise we are not going to force. So, but in the preparation guided by the people who have walked the paths themselves, and that is the examiner as the trainer, mostly me and the Dr. Shane, who has followed this course successfully and achieved the real success from MRCGP International as well as the MD Family Medicine, the board certification. And the curriculum structured and that is the faculty with hands-on postgraduate training and examination experience. We provide that. The curriculum structured and mapped directly to the PGM prospectus, the learning materials included. The regular mock exams, past paper discussions, and the personalized feedbacks are being given. So dedicated is the mentorship for both state and the private sector doctors. Both physical classroom sessions and the live online sessions are being going on. Plus the newly, the given learning platform that you can go ahead for the card payments as well. That is very much the economic friendly. So the next. Shin, can you show me that our little bit? I'll show you how this platform works, the learning platform, for you all to just to know. In case if you, I think it's really good thing because I know how I prepared that with the experience that I have. Even I have prepared for that MRCGP International, the very much highly success rate. So because the examine experience is a different thing, so which we can share among you all. This is the learning platform. No, put it there. That is the learning platform is mrcgpfasttrack.com. Once you put that, the website is coming. Right, and after that, you can select from the dashboard whatever the things that you want. Either you want the MD selection exam or the courses, or you want the MRCGP, AKT, or MRCGP International OSCE, whatever it is, you can, right? So the other postgraduate examination, you can. So click on that and it will come in the clear step-by-step instruction that guide learners in a very friendly way through the platform. Organized study modules, notes, structured questions, everything is there. Anytime, anywhere, at your convenience. Wherever you go, the learning platform comes with you. So go to that. You have to register only that with the nominal fare that we are going to give you. Thinking about promote our primary care training in our country. Being the specialist, I know how much it is essential. and I know how much challenges we faced to get through these exams. So because of that, I don't want you all to suffer in that way. So that's why I made this. Okay. Next. So we have our physical and online preparation programs as well. Most of you all have, the attending, I think. So some of you all have. So because of that, you know what this is. In-person classes and the revision workshops, face-to-face mentoring. In case of OSCEs and the hands-on practice sessions. The online sessions mostly for the MR CGP AKT and the MD selection, but we are not just discussing the question, but we discuss about the topic, that question based on, and how the questions can come in a way that whenever the exam focused, right? So that is how we are doing the questions, the discussion according to the guideline based, right? So for an example, yesterday during our AKT question, the one candidate was asking from me, that is, the hepatitis. This is the pregnant lady coming with pruritus. You must know that is very important thing to exclude the hepatic cholestasis and from the HELP syndrome, right? So both in that case, the pruritus could be, but the one the doctor says the markers are, the AST, ALT, and the platelet counts are the hematological markers. So in order to find out whether the patient is going to get into the HELP syndrome or the liver involvement more than just the mild intrahepatic, the cholestasis, where no need to admit and the reassurance and the repeated checking of the liver functions are necessary. But in this question came that, they are asking the alkaline phosphatase, how that alkaline phosphatase detection is helpful in this case. So they are asking. So your knowledge must be there. In pregnancy, so normally the alkaline phosphatase normal levels go up by 2 to 3 times more than the normal person. So because of that, according to the guideline says no. ALP levels has not been taken as the marker in pregnancy, right? That is because of the physiological changes that happens inside the liver to get that raised ALP, this thing. So that is a very, the evidence-based manner we have to know the go ahead and explanation about then what is this HELP syndrome. In addition to that, pruritus, what are the things that you're going to ask from that patient to exclude that the HELP syndrome, like the blood pressure, fits, and the facial edema and all. Not so only just pruritus, provided that thyroid function also being excluded, so we can manage the patient. So you must know pregnancy and pruritus management. It's a very crucial thing that the primary care physician may come across. In such a case, you have to be patient, the safe. So that's why your knowledge, that is the thing that I told you around the topic, we are giving you the knowledge as well, right? So the next, even pre-trials are there for you to go in to the learning platform and see how it is helpful, and then you can decide whether to buy it or not, right? So just go in and check it. So this is just the showing about our marking the learning platform for you all to know, right? So Dr. Chen, can you just explain a little bit for them, because to facilitate their...
Madam, I can show the website now. I'll
Yeah,
take it
this is the
from here.
website you are showing.
Yeah. So basically,
And
so this is our website. The
go to the
name is,
learning.
yes, of course. This is called mrcgbfasttrack.com. So how you access so I'll show you how we navigate this website.
Yeah. You're not there, Shane. Screening is not sharing. Shane, are you sharing the screen?
Just give me a moment.
Yeah. Yeah. It's not there.
Right. So this is our website. So it's mrcgpfasttrack.com. So I'll just show you some of the features in our website. So this is the home page, and so you can sign up for free from here to create a student account, and so also you can access our courses via credit card payments now. And also, if you sign up, you can see 2 free preview videos for every course for the free sign up. And so this is just to show you. And these are some pictures from our training sessions. So this is what we do. We do hands-on training on physical examination, where according to our experience, especially Dr. Malkanthi's experience as an examiner, a lot of candidates have struggled in their physical examination techniques. So this is what we are doing during physical sessions. And these are some of the testimonials of students who got through after following our courses, especially MRCGP International. So some of the candidates are foreign candidates, including from Bangladesh, India, and also from Middle East countries and Sri Lankan doctors working in Australia. Right. And just to show you the courses. So if you wish to enroll for our MD screening and DFM preparation, so this is the one. So you can register and you can check the details here.
Go for the MD selection?
Yes. So this is the
Right.
MD selection one.
Show them that, how they can go to the SBA.
Yeah. So so this is the curriculum and things like that. And also you can download the course brochure here.
We are going to give you the nominal fee, which is not mentioned there because you all are our people and,
Yeah.
we have to help.
And this is how you access the LMS portal. You click on this icon here, the LMS portal, and then here, of course, you will be taken to a page where like this, you have to enter the username and the password, so which will be given to you when you enroll for our course. And then these are the courses we have. So, so for example, the family medicine preparatory course, it looks like this. So we have shared the past DFM papers as well as the MD papers here. And also the online class recordings of our sessions will be can be found here. So it will look like this. Can you see the video?
Yeah, can. Investigation for the all C is clinically stable and not acidotic. So regarding the question, you must know the true or false answer. Regarding the diagnosis, other important thing is the last question.
Right. So so the video was clear, right?
Yeah, video is clear. And
Yeah.
go to the SBA,
Questions.
the model, the last time mock exam
Yes.
and SBA questions, and 1 or 2 written or skill.
Yes. So the online recordings are here. And yeah. So just to show you how the questions are, the true or false questions come. So the questions will, for example, will come like this. So vertebral fractures may occur silently. So like that. So you have to answer either true or false.
And go to a little bit of case scenario based,
Yeah. So when you can select the answers and check your knowledge also then and there.
show them the answer.
So it will come like this. So the answer and the explanations will be given below the question. I hope that's visible. It's clear, right?
Yeah, clear.
Okay, right. And
Show them this
the written
SB
OSCE, yeah.
or
So the written OSCE questions, for example, will look like this.
put some cautious question as well.
So, for example, so these are the type of written OSCE questions that will come, right? If for the selection exam, right? So there'll be a picture like this, and this question says a middle-aged old lady comes with a rash, slowly enlarging reddish brown plaque on the face for 3 months, and not responding to local steroid cream applications. So question like what is the most likely diagnosis shown? So what is the clinical sign? Like that, so you can practice your answering
Show the
questions.
answers. Show them the answers that we have provided.
Madam, මේකේ පොඩ්ඩක් answer එක මම දාලා නැහැ. I will show you a different one. Yeah, the question will come like this. 52-year-old man presents with a severe pain, swelling, redness, and warmth of the knee for 3 days. So there's a photograph here. So what is the most important diagnosis that must be excluded? So list 3 like that. And then the question 2, some more additional data. And then what is the most important investigation to establish the diagnosis? And question 3, synovial fluid showing negatively birefringent crystals. What is the most likely diagnosis? And question 4, how would you manage this patient? Right? So the answers. Yeah. So the most important diagnosis. So septic arthritis, gout arthritis, meniscal tear. So those are some of the answers to the question 1.
Right. Then can you show them this one, Shane, the MCQ and the SB MCQ paper? That's where the lastly the formed by
Sure.
prepared by this one with the answers how it comes.
Okay.
That is a very good, the 2000 around more than nearly 5000 questions are there. So you can mostly practice and find out the most of the MCQs will be covered, right? For sure. And this BA together. So because of that, it's in case of interest, so better use that. But anyway, as you know, the common message I'm going to tell you, but start the preparation now itself with the group discussion. It's with the correct people. It's very, very important here. And the other important thing is, after getting the discussion, better, not to the talk in between the unwanted things. You have to have someone to control to the group and get, the online, the support services and the resources, whatever, for the guideline answers to select one or two people, assume for that, and one person to read the question and others, and then after going through that discussion, why should it is not correct and why should it comes as correct, you have to point out the guidelines. This is that, like that you have to go through the discussion team. That is very, very crucial. Everyday discussion, right? Not, the in the once a week discussion. I recommend for you all, your discussion among your group is very, very crucial for the to achieve your success. And the next important thing is to do your own studies after the having the discussion, to the make that, the knowledge, the thorough, right? That is the reading. We have the guidelines as well. I'll show you that. So guideline summaries are very important in this exam. Otherwise, you will be nowhere, right? So the all answers must come to the guideline base. So because of that, it's very crucial for you all to go ahead, to follow the guidelines. That is for your own the discussion. So you have to, but better ready those guidelines as well. Even though no books are there, no any other things, if the guideline are there with your the side for the discussion and to for your personal learning, it's very, very important. And you have to know the focus within what are the common things that they are asking. Always they ask for the common things, right? So for an example, the dengue fever. So what are the criteria for the admission? Being primary care physician is very important. That is being asked anywhere, anytime, right? In the primary care exam. So that is because of your knowledge is very important. In a way, that's very important things they will focus for you to check your knowledge, right? And in such a case, and the unwanted admission, you will, you are not the qualified for that getting into that. So you have to have a correct evidence-based knowledge according to that. It's not your own this thing like the Gasla Bukola or whatever it is, not the thing come into play, but it's the evidence-based and the guideline-based on the answer. So keep that in mind. And how do you differentiate the leptospirosis? So what are the common fevers that we come across nowadays? The dengue fever, and during exam time, it's very important. Leptospirosis, and sometimes even though malaria is free, the import malaria cases are coming. That also very vigilant that the GPs and all should, have that idea about that. That also very important thing. So, and the infectious mononucleosis, so the oral, the bacterial pharyngitis with fever, and chronic sinusitis with acute exacerbation of fever. So those are the things that common topics are common. So you must have your evidence-based knowledge on these things, right? After having the discussion, you have to be thorough with this reading and go for the mock exams that we have done so that you can the narrow down your the knowledge, the into the focus into the paper. Going here and there without no idea is no use. Shane, this is the MCQ question, right?
Yeah,
Like,
this is a single best answer. So, for
hmm.
example, it will look like this. So, one of the questions here, a 48-year-old woman has confirmed stage 1 hypertension, blood pressure 145/92. The Q-risk score is 6% and no target organ damage. What is the most appropriate management? So, we are testing here your knowledge of the evidence-based guidelines on management of hypertension.
To mark one answer and show them.
Yeah. So, I mean, here we have start statin, start beta blocker, start ACE inhibitor, refer to cardiology, and lifestyle advice only. So, for example, if you pick this answer and check. Yeah. So, it will say your answer is incorrect, right? Because here, in this scenario, start with lifestyle advice. So that's why. So it will show what's the correct answer as well as the incorrect answer. So likewise, for each question, you can check your knowledge. So A 61-year-old man reports chest tightness on exertion, relieved by rest within 5 minutes. What is the most appropriate initial investigation? So, if the audience, those of you who have joined us, you can tell us what your answer is. I will click on the answer. So, if you know the answer, please type it on the chat box. What is the most appropriate initial investigation? Okay, one of you have mentioned as D. Okay, let's check whether D is the one. Exercise ECG. No, the correct answer is not that actually. So correct answer is CT coronary angiography, which is according to the NICE guidelines, is the first line for stable angina. And exercise ECG is not recommended for diagnosis. So the correct answer is CT coronary angiography. So this is an example of how useful and how we can use the learning platform to
And
the
so then the
maximum
guideline now.
effect. Yes, there's one more thing I couldn't show you.
Then once you go to that, so you can go to the guideline and read about that. I must read about that guideline. Like that, there
Yeah.
are so many guidelines.
So here we also provide access to NICE guidelines, summaries, which prepared by Dr. Malkanthi. So for example, cardiology, stable angina. So like that, you can read the guideline summary over here, right? So this
It's
is
only
about.
that, you see. The important thing is summarize the guideline. So that is, the guideline says, it's, the management diagnosis. So the clinical features, the diagnosis is okay. ECG normal, or may show ST depression or the T wave inversion very mild. And as well as, the troponin normal, but, the confirm the management with, the going down. It's, the confirm the diagnosis with this is the one CT angiogram, CT coronary angiogram, right? Which is, the offer invasive strategy also you can offer, but more than that, although you are thinking about the exercise ECG, that is not the exercise
Yeah,
ECG.
madam, the answer is here.
Yeah, there you see. The
Undiagnosed
diagnostic
diagnostic
uncertainty remains. This is the CT angiography is the one. Very important thing, right? So this is the NIVERS guideline that we have, and not only that, the diagnostic, the after your diagnosis, it's not to the wait for the diagnosis, but on top of that clinical diagnosis, you can manage the patient with following medication as well, right? That is, the beta blockers and the aspirin, and as well as the go down chain. There. These, if symptom persists, you can go ahead with the long-term, long-acting nitrate, but aspirin is a must, and the statin, the higher dose is the must, like 40 to 80, right? And the control of the comorbidities is a must. So it's very simple that everything is mentioned there. And show them another the guideline.
Yeah. So here is actually a good example, although we don't see this being done where we are practicing. But when we go for exams, we need to know the evidence-based correct answer.
And it's very important, and guideline, if you're going to read about the NICE guideline on stable angina, you get mad because so many pages. But we have summarized with the essential things only.
Yeah, now I'm going to show you a different one. Is this visible?
Yeah.
Yeah. So this is a guideline summary on heart failure. So, so it gives you the key concept, classification, clinical presentations, red flags requiring emergency management, and what to do for diagnosis. For example, BNP and NT-proBNP. So that's the most useful investigation according to the guidelines. And non-pharmacological management and pharmacotherapy. So this is all summary from so these are the 4 pillars of heart failure management. ACE inhibitor or ARNI or ACE inhibitor, right? So sacubitril valsartan, that's the recommended medication for heart failure nowadays. And beta blocker, then mineralocorticoid receptor antagonist, and SGL2 inhibitors. So for correct best management of heart failure involves these 4 pillars. So like that, so we introduce through the NICE guidelines, this NICE guideline summaries, so which will be beneficial for you when you prepare for your studies. Madam?
Yeah. So that's it. And the other thing is little bit of, that is not interested at the time, that just show that our the 50 the videos, just one
Videos, yes.
yeah, just show them only, and the mock that we have done, last mock,
Okay.
just to show you that, because even if someone needs that, the support even from the MRCGP, internet for the MRCGP, and you better do, you're the ones you get through or not getting through, better do the MRCGP International. That is being recognized, you can straight away go to Australia and some other countries to practice as the GP. You're going to get very good salaries and no need to do the AMC and all. Only thing that you have to do is, the OET, that is occupational related English, the competency testing only. You will be recruited there. So very easy. So even better, even you don't get through from this exam, you can do the MRCGP pathway as well.
So I can just show you one video.
This is ideal mock like the MRCGP exam or the same MRCGP and the this thing, OSCE. So you have to know the OSCE also little by little before if you have the real target to get through this exam and you are hard, the working, then you have to know what this is as well. පොඩක් දාන්න ඉස්සරහට එතකොට it will play. Here. How can I help you? Doctor, I'm getting pain in my face, doctor. I'm sorry to hear that, Mrs. Pereira. Can you please explain more about it? Yeah, here this area, doctor. So I used to get for about last 6 months. And now it's getting more, doctor. I can't bear that up. This is where I'm acting as the SP and the examiner as well, because I'm telling him at the end that these are the weakness of yours to know the need to know the improve. The gaps need to be improved. This is the MRCGP, the candidates we have done the mock exams, right? Okay, so I think I shooting pain. Anything else that you want to know
Madam, there is an interesting question.
Yeah.
So I will read out that question for you.
Very good.
It's from Tarindu. Madam, currently there seems to be some disagreement between physicians and pediatricians regarding family medicine appointments, consultation, and training opportunities. I have also heard that there are some legal issues related to this situation nowadays. Considering these current challenges, could you please advise whether family medicine is still a secure and promising career option for the future? I would really appreciate your opinion and guidance regarding the long-term prospects of this specialty.
Yeah, that is very good question. Because when the last year I was the president to the Sri Lanka College of Specialist Family Physicians. With that, I am the one that faced almost all the challenges to achieve this success what we are currently experiencing. We are in the base hospital and above outpatient department as the clinical head, and we are the specialist, the family doctors to the OPD doctors. We are very closely working together. I'm working at BH Panadura, and there are 16 others people are working at the base hospital and above places. The district general hospital and the base hospital outpatient department, they are doing the very good job. That is the first contact care. That is, all the patients are coming in that suburbs to us, and we do the clinical, the management of patients whenever necessary only we are sending. You are correct. So we had, enough the legal challenges, and we have come to the end of those legal challenges now, because no one, even VP and the pediatrician with the narrow mindset, that thinking that they are secondary, the care trainers, because they are secondary care people. So once we being referred to them for further high-tech investigation to confirm the diagnosis and giving some IV antibiotics, and the high-tech, the investigations like the blood, the pictures or whatever, the chemical and the pathological test and all, only they need to get admitted, right? Because under observation and the other things. So other than that, even at the Panadura Base Hospital, I'm telling you, even we have all the chemical and the pathological testing, including thyroid function and vitamin D levels, vitamin B2 levels, we can send to the MRI, get it done at the outpatient department. So whenever the patient comes with the bilateral benign feeling of numb, the numb feeling of both the feet, we are not going to send that patient to the secondary care as they wish. That those the things that they want to get that the patient overcrowded and let the patient to suffer, and wanted patients are being neglected due to overcrowding in the wards and their clinics, which is happening because of lack of primary care, another structure. Now, because of our discipline, fortunately, the Ministry of Health has been the placed us to the correct places with their real, the objections. But, we have, come across that we are being placed as the PSC appointments, and we are being treated as equal as the other specialists in the country, where you can't put into the base hospital, the down below the base hospital, because MO card is only the division hospital and the below. So we are being correctly placed because we are recognized by the service minute. So no one can change that. So because of that, they are, even though they struggle, like the same way that they struggle to the against the medical administration which came recently, but the community medicine discipline was the earlier. But the community medicine people were, really hit them hardly, the medical administrators, to not into coming to the administrative positions. But finally they won, and that now they are the one in the such positions, but being sidelined, they are for their preventive work, the community physician. Like that, they are hitting us, but we are challenging them, and we have mostly the one, right? So in future, definitely the primary care is the world recognized thing, and the World Bank, WHO, and everyone is, the helping us to grow that structure, and it will be coming. So don't worry. You are such the lucky guys, because I am the one with the Dr. Shane and their teams. Juniors supported me very well. And with that, the challenges I faced, and most of them have been, the recovered now, right? But the Director General Health Service and some other officials are really want to establish this system. So because of that, it will be established. So that's why the PGM also, there is a block that they are not going to take the necessary amount, like around 30, like we can train you all, because we are training centers attached to the PGM. But they, the block there, because the former PGM director was badly hitting us, and one of our PGM, the one of our the consultant family physician who is there in the university field, also obstructing us by getting the side of VP. That is the unfortunate thing, but it will not happen in future, because everything, the correct things are happening, according to the nature. So don't be scared about that. Your future will be very much safe in Sri Lanka, and as well as the other countries, more than the other specialists. For my MRCGP exam, the training program, most of, the even anesthetist and even the pathologist and those people are joining and get the qualification and go, because their salaries and everything is really good. So because of that, better not to give up any of these things. So better motivate for the real. It's interesting, the training program with correct the guiding to the exam, and you will be very much the improved with your general practice, private practice, and the practice at the hospitals, and you are highly thrilled with this. So nothing to worry. Okay, have I answered? That is the mostly the byword, they are spreading rumors more than what exists inside the Ministry of Health, because to discourage the family medicine discipline coming up. So don't worry.
Yeah, there are other questions.
Mm-hmm.
So some of the questions we already answered. One question is DFM essential to sit for the MD selection exam?
No, it is
So
not
that is
necessary.
not essential. So Madam also mentioned that in the presentation. You can enroll directly without the DFM qualification. And there's another question.